doing a neck lift and a brow lift on a female patient using Aptos threads. For the neck, we're going to use the light lift technique using needles, and we're going to use a hammock technique, and I'm going to show you how we mark the patient now. So if we move...
Perfect. That's it, that's perfect. So if you get her to stand...
I'm going to show you how we've done the markings. So starting from the patient left side, you can see the two blue lines starting from the mastoid, the area behind the earlobe, and you have one line crossing in this direction, crossing the midline into the opposite side in line with the angle of the mouth. And the same applies for the second line, which comes and crosses the midline into the opposite side, and it stops at the vertical line. Pencil is a white marking pen, and you can see we use very similar configuration. But what we're trying to achieve is a hammock technique. So from the right side of the neck, the line, the white line, comes in this direction between the blue lines, and again crosses the midline into the opposite side. And the second line comes a bit lower in the neck and crosses the midline into the opposite side. The end is the one. Of the hammock technique here. So these dots, which are drawn in line with the angle of the mouth, are the exit and re-entry points of the threads, and you can see them on either side. And we're going to use those points in order to create a hammock technique. So we're crossing the threads in the midline in this configuration in order to achieve a superior pull of the skin. So these are the markings now for the brow lift, and you can see the 1, 2, 3 dots. One is at the level of the anterior hairline, and the other two are just superior or cranial to the eyebrow line. So we are going to use our procedure now. So we ask our patients to
sterile field around the patient. Both doctors are fully sterile with sterile gloves.
3. A bit of pushing now. I think we need to do more. Ready to introduce them through the entry point, which is sure the area is free of hair. So we introduce them. So now we have the two needles, and we have to cross them in this way. So the needle on the left is going to move in this direction, which is line A or point A, while the needle on the right is going to go down and it's going to go to the point is for the needle on the right. So in this way, the needles are going to cross in the neck. Okay, I'll put my first point. I'm ready to come up. So with my left needle, which is going towards the point A or point 1, now I am in this dot that we drawn previously, and I'm gonna exit at this point, and then I'm pulling the needle out until it's about 0.5 centimeter from the entry point. I can see where the tip of my needle or the other side of the needle is, so I'm slowly exiting. It's there now, a little bit more, and now I'm turning it around. And now this becomes the same point, it becomes a re-entry point for the other side of the needle, and I'm moving on now to cross the midline towards the other side of the neck. And I'm here, I'm about to come out, I'm coming out through the other point and I'm exiting. I can see the tip of my needle is here. Step 3. So I'm just pulling the thread and I can see that as I'm pulling, it's coming out up to a certain point. So now I'm locking my thread, it's not coming out anymore. Now I can continue with removing the needle, and it's almost out. So I'm just going to turn. Now it's come off almost, but not yet. Now it's coming out. Cut. The tip of the other end of the needle is here, about 0.5 centimeter from the exit re-entry point. So at this point now, I'm just going to rotate my needle 180 degrees, and then I continue towards the opposite side of the neck. Can you bring your head towards me, please? That's great. And I'm continuing in this direction now. Free, we'll secure it, put it back in the set. And now we're going to go into the point 3 in exactly the same way. So advancing the needle. Now the exit point here is the point in line with this vertical line that runs from the angle of the mouth. So this is where I'm going to come out with the thread. I can see that the tip of the other end of the needle is here. So I'm very close to the skin, a 0.5 centimeter from the skin. So at this point, I rotate 180 degrees and I continue towards the other side. And this is my other exit point. So I'm just pulling it, and now I cannot pull it anymore, so the thread is locked. So now the next step is to continue by removing the needle. Again, I'm very close to the skin now, about 0.5 centimeter from the exit re-entry point. So again, I rotate 180 degrees. And I re-advance it, and I'm aiming for this point there, which is point 3. Cutting the thread. Okay. So we're going to move into the other side. Degrees, and I continue advancing the needle. So I stop, and now I'm just removing the needle. Again, the tip of the needle is here as it's coming out. And now it's about 0.5 centimeter from the exit re-entry point, and then at this point again I rotate 180 degrees and I continue to the opposite side of the neck. Below this blue line.
Cut the video. Cut the video. Yeah.
You just need to put it in the correct way. Hold it and just do that. And remember to go a little bit more superficial. Thank you.
Okay.
Go ahead.
And I continue in this direction. So now, as you can see, the threads are in position. So I'm just going to pull the threads in opposite direction. As you can see, at the points where we cut the threads, there's a little bit of bunching of the skin, but this is not worrying. This is going to settle. We just have to tell the patient just to continue massaging the area and it will settle nicely.
Perfect.
Yeah.
That's it. The anesthesia is that thing.
Go in with a cannula through.
As previously, entry point, okay? And we separate them. This one goes down and this one goes up. So we're going to start with the lower one. The same technique as I'm coming out, rotate, parallel.
Yeah, 90 degrees, yeah.
We're at step 3, right?
Step 3, so again, we have to.
Again.
Pull the thread to lock it.
Rotate. Don't come the same, exactly the same.
No, just
hole,
next to it.
yeah. No. Because you're a plastic surgeon, you can see that easily. After 1 or 2 cases, you can open a small hole over here and stitch it inside.
Yeah, yeah, yeah.
Okay?
Yeah.
Okay, so you will say that we already passed one. We're going to keep it and then go into the other one.
Again, at this point, I'm pulling the thread to lock it. And see, I cannot pull it anymore, so the thread is locked. I'm coming out. This is the tip of the needle coming out. And at this point, I rotate and continue cranially. And that's my second thread now done. So I've got my threads. I'm holding the threads into my fingers and you can see the pull. So I'm checking for symmetry before I cut them, and I can see they look pretty symmetrical.